Hi everybody, this is Matt. Thanks for watching and welcome back. A viewer asked a question about how to deal with essential tremor when it comes to shooting a pistol. Well, for those of you that don't know what essential tremor is, that is essentially a much worse version of what I would call shaky hands. It's a neurological condition that can affect basically anybody, but it's very common as we get older, especially past the age of 40 and 50 years of age. It tends to affect the upper body. It affects the hands, the arms, even your chin and your head. So it can cause what would be called a nervous tic. But somebody with essential tremor, if they were to hold out their hands like so, instead of the hands being reasonably stable, now we all have some shake and wobble, but instead of being reasonably stable, you would see something like this, maybe something like this. If they bring their hands up here like so, you're going to possibly see this, or one hand is a lot worse than the other hand. Now, I'm assuming that you've been to a medical professional and they've talked about potential treatment options and things that you can do to help yourself. But if you're going to try to work on it when it comes to with a pistol, my recommendation would be common sense and good judgment. Which means, first and foremost, you've already talked to a medical professional about it and you're taking that route. Secondly, you want to document where you are now, where you're at today. And one of the easiest ways that I can think of is if you have a pistol with a laser, or maybe you have something like a CERT trainer, take your telephone that usually has a video camera capability to it, set it up in a room, and take the laser and simply turn it on like this and point it at a wall. Now, if you want to get real fancy, I'd duct tape a yardstick up there so you can really have a baseline. So you would say, okay, today's date is such and such so-and-so, and you're going to go ahead and you're going to present out, first of all, with one hand, and you're going to document how much wobble you have. So if you have this much wobble going on, like so, or whatever, you can actually document that, and you would have it measured out in inches, that on this date, at this distance, I have this much deviation. And you can try one hand, you can then try the other hand and see if it has worse deviation, and then you can also use two hands on it. Now, notice, two hands, you're going to have a lot, smoother. But the farther away you are from the wall, the greater the angle of error. So it provides a very good baseline. But that's day one. So where do you go from there? Well, first and foremost, we have to understand that our body is essentially a machine. And a machine, sometimes gets old, it wears out. But with proper maintenance, we can usually prolong the life expectancy, right? So when it comes to dealing with something like essential tremor or shaky hands, one of the things that I would do is I would use grippers. I would exercise with grippers. I would do it very consistently, very regularly, in order to exercise all those small muscle groups. And then I would use something like this rubber band and use this so I am exercising them in balance. But it does not stop there, because I have seen a perfectly fit 30-something-year-old man that has essential tremor in his hands very bad, but he is a machine. I mean, that guy can just do it all, but he is bedeviled by essential tremor. Why? He doesn't know. Neither does his doctor. But anyway, use grippers, use a therapy ball, use something like Expand-A-Bands like this, because you want to use your muscles in balance. And then you also have to remember that everything is interconnected in your body. So usually what I will do is I'll use a free weight like a dumbbell, and I'm working the wrists like this, like this, like this, and I'm also holding the weight out, and I'm exercising the forearm. And not only do I do that, but you're also going to tell that this goes all the way up into the shoulder area. So when I'm doing free weights, I've got the weights in my hands, I'm coming up like this, and again, it's something that's very, very consistent. You're coming up like that, you're doing this, you're doing and exercising your tricep muscles, you're doing reverse flies. You're really trying to keep those muscles working and to build solid neural pathways. Now, you don't have to overdo it. You don't have to be macho man. You don't have to pick up 50 pounds of weight. You can just do 1 pound if it works, 5 pounds if you can do it. But again, something consistent, because you want to get circulation into the area. You want to make sure that your neural pathways are as good as they possibly can be, and try to do everything in balance. So once you've done that over a period of time, let's say a month, then you go back and you do the baseline again. Don't do it any quicker than a month. Give yourself at least a month before you first go back and you do that baseline. You turn your laser on again, you're standing in exactly the same spot as you were before, and you're presenting out there and you're seeing exactly how much movement that you have, seeing if it's reduced. Because that way you will know. You will know if it is indeed helping you or not. But the one thing that I'll caution you about when it comes to basically rehabilitating ourselves or getting ourselves back into shape, these smaller muscles that are involved in our hands and our wrists and everything actually take longer to train. So don't get frustrated if the results don't come quickly enough. But I would go ahead and work on that. If you have one hand that is steadier than the other, maybe you should switch over to that hand. But also, when you go to the range, make sure that you go ahead and you use a two-handed grip to try to mitigate it. But those are a few ideas. I hope that this helps you out a little bit, but I would say continue to fight it. Don't give up. Don't become sedentary. Get active. And remember, it isn't just in the hands and the fingers. It's all the way up into the shoulders. That's what supports that pistol grip. And so, just stick with it and talk to professionals out there in the medical field, in sports physiology and things like that, and see if they can give you some tips that will help as well. So I hope this helps, gives you a little bit of guidance. I hope it makes sense for you. And until next time, everybody, thank you very much for watching. Have a good one and be safe out there.